Hello, everybody. This is Dr. Mohammed Adil from United Kingdom. Recent extensive survey carried out by Medical Protection Society and the British Medical Association UK have revealed that there is a petty cruelty of the General Medical Council against the doctors belonging to the ethnic minority. In 2019, Dr. Arora, GP from Manchester, was alleged for dishonesty about a computer from the NHS to the Medical Council. She was then suspended by the Medical Professional Tribunal. After a backlash, GMC decided to withdraw the suspension of Dr. Arora when the case went to the High Court. But she had 3 years of very crucial time, which is totally unjustified. Similarly, Dr. Hadiza Baba Gaba, a trainee pediatrician, was dismissed and erased from the General Medical Council register on a death of a 6-year-old boy. The consultant in charge on the day, who was medically responsible for that boy care, received no formal consequences whatsoever. It was argued that the GMC approach led to culture of blaming individuals without judging the facts of the case. Elsewhere, there were concerns that Baba Gaba had been unfairly dismissed, and if she had been white, the result could have been different. She belonged to Nigeria and was black. With the help of the public support, Dr. Baba won her appeal from the High Court and was reinstated on the register. Similarly, Dr. Umar Karim, who was a consultant urologist in Ealing Hospital, he blew the whistle against the discrimination and harassment at work by his colleagues, and he was referred to Fitness to Practice Tribunal, and they suspended him for 4 years. After 4 years, it was concluded that Dr. Umar Karim was not guilty of the offense alleged on him by the trust and the General Medical Council. No financial incentive could reverse his last 4 years in agony which he went through along with his family. Similarly, Dr. Almasuddin Qazi from Pakistan Heritage, is a consultant general upper GI surgeon, has been suspended by the General Medical Council for the last 12 months, and prior to that, he has been working under condition because of his viewpoint on the COVID pandemic in a couple of his videos. He is going through Medical Professional Tribunal hearing next week. This clearly shows that overseas doctors belonging to the ethnic minority are targeted, crucified, and discriminated unnecessarily without knowing the fact that 55% of the doctors belonging to the ethnic minority working for the NHS are the backbone of the NHS in many ways, but they are treated differently. For example, recently, on 22nd of January 2022, Dr. Steve James, consultant anesthetist, King's College Hospital, London, he challenged Mr. Sajid Javed, Health Secretary, in accident and emergency on the mandatory vaccination to the health professionals. And he refused to have a vaccination himself. On his stand, the government took U-turn and 80,000 doctors who was supposed to resign because of the compulsory vaccination were saved from having vaccination. But I would like to ask, so what action has been taken against Dr. James by the Trust, by the NHS, and by the General Medical Council? Is it not discriminatory? Similarly, Dr. Hildy Jones, who comes on the Great Britain program in the morning radio show, he generated 4,000 complaints against him within 48 hours because of his misinformation regarding unvaccinated patients in London hospitals. But no action was taken against him by Ofcom, by NHS or General Medical Council. Similarly, Dr. Tess Lary, who is a scientist, she tried to promote ivermectin for the treatment of COVID-19 instead of vaccination, which was totally disregarded by the government. And I wonder what category of misconduct Dr. Steve James, Dr. Hildy Jones, and Dr. Tess Lary come, because there has not been taken any action against these three medical professionals. Neither Trust, nor NHS, nor GMC has taken any action against them. But I was penalized and crucified by the General Medical Council and the Trust with dismissal and suspension for the last 2.5 years. Is it not discriminatory towards the experienced, skilled, and highly qualified doctors from the ethnic minority? I leave this question to the public to answer to me. I really appreciate the public who has been standing for the truth and supporting the cause of freedom of speech and expression, because I believe strongly on freedom of speech and expression, freedom of holding an opinion, freedom of press and publication, freedom of religion and worship, freedom of working gracefully at the workplace in a secure environment without any discrimination and harassment, freedom of thoughts, security, and equality. NHS, since has made lockdown on the public services in the hospital, the waiting list have piled up to 10 millions now, according to the NHS figures. And there are hundreds and thousands of doctors who have either resigned are they resigning because of dissatisfaction from the job. These doctors should be brought in back to serve the community, to treat their patients, especially the cancer patients who have been waiting for a long time for the investigations and treatment. I strongly believe on Nuremberg Code, which is based on the medical ethics, reminding us of Nazis' atrocities on human beings with inappropriate, unethical, and illegal surgical procedures without their consent. I believe on Hippocratic Oath, which says, do no harm. And I believe on Helsinki's declaration for the medical professionals to conduct a research work funded by the federal government. I believe on the bodily autonomy of everybody without carrying out any procedure. And I totally believe on the informed consent by every patient for starting any medical or surgical treatment. I enjoyed very good services for 30 years while working in UK and served my patients with dignity, pride, honesty, and hard work. And I never discriminated anybody on the basis of color, race, individuality, religion, or belonging to some part of the other world. My case is gone to the High Court for the justice because I have been dismissed and suspended for the last 2.5 years because of expression of my speech and holding an opinion regarding COVID-19 without having any clinical, moral, ethical, health, or social concern whatsoever by the trust or by the General Medical Council. And I have 30 years of unblemished record while working for the NHS in UK. But I have been penalized because I have spoken the truth. So my case is in the High Court for the justice. And I need your help for supporting my cause, for standing on the right pathway, speaking the truth and fairness for my public and my patients who are with me. And I'm grateful for your financial support. And I would request you to donate more on the Just Giving crowdfunding page for contesting my case in the High Court for justice. Thank you ever so much for listening to me. And I wish you all the best for everything.